السلام عليكم. معكم مصطفى الحسن بقدم لكم الأوتومود في الميكانيكال ventilation. The objectives for my presentation I have introduction, how Automode works, indication, advantages, disadvantages, and conclusion. Automode is a feature, not an independent mode actually, and can be activated or deactivated on any of the control modes. It is one of the non-traditional winning methods. The traditional winning methods are SIMV, pressure support ventilation, and TBs. Automode is a feature on Servo 300 and Servo I ventilator. When Automode is activated, a little green icon here will be turned on. How Automode works. On any control mode, we have mandatory breaths and assisted breaths. But when we activated Automode, the patient is relying on the vent and the patient is getting mandatory breaths, as long as the patient is not triggering the vent. Once the patient has two consecutive triggering the vent will switch him to a support mode and remains in this mode as long as the patient is breathing spontaneously. But after switching on a support mode, if the patient got apneic for some reason, or let's say no patient effort for a certain period, the vent will switch him back again to a control mode. Okay, when the patient is on volume control, the support mode will be switched on as volume support. Pressure control will be switched to pressure support. PRVC will be switched to volume support. Apnea period. This is the time when there is no patient's effort is detected by the vent, and result in switching from a support mode back to a control mode. For adult, it's 12 seconds, pediatric 8 seconds, neonatal 5 seconds. Activation Automode feature is indicated for patient who is candidate for weaning and discontinuation for mechanical ventilation. Advantages for Automode: the work will be shifted completely to the patient after only 2 consecutive triggering. The work will be shifted back completely from the patient to the vent after an apnea period based on the patient category, as I mentioned last slide. Disadvantages: if the patient is triggering the vent but not yet ready for weaning and a support mode, the vent will switch it to a support mode, and that could increase the work of breathing. There is no alarm activated when the shift occurs, it's only a little green icon will be turned on. Automode shouldn't be used with neuromuscular blocking agents or drugs that depresses the respiratory drive. Switching from control mode to support mode will causing a drop in mean airway pressure. However, this is a serious disadvantage and not appropriate for patients with high oxygenation demand, such as acute respiratory distress syndrome. As we know, ARDS patients need high oxygenation support, so Automode feature is not appropriate for them. Auto-triggering could be sensed as patient-triggered breaths, causing a switch to the support mode. Finally, Automode is an effective weaning technique that requires fewer ventilator adjustments than other weaning technique like SIMV. Let's say we have a cardio-surgical patient just sent to the ICU from OR or slow weaning extubation. Activation Automode could help the therapist and minimize our interventions. We can disconnect the vent and extubate the patient on Automode. There is no need to switch the whole mode to any other weaning modes before extubation. Also, there is a study stated no evidence for Automode to speed up discontinuation from mechanical ventilation comparing to other weaning modes. So Automode basically allows the patient to switch from mandatory breaths to supportive breaths and vice versa. This is the references I used. I am grateful for your time listening to my presentation. Any question or comments, my pleasure to respond.